clusters, and then they sent them back into their own hometowns. These were some of the works that were done, and also the kind of work that other schools of social work also had similar kinds of works done. But have we ever thought what has happened to our domestic laborers, like the domestic workers that we've hired? If we could have had housemaids in our households, we would have stopped them. What has happened to their livelihood? What has happened to our rag pickers who came by? Our newspaper wallahs now might be coming up because all the lockdown measures are taken. But during the time of the lockdown, during the curfew that was being imposed, what would have happened to all these people's livelihood? That is a greater question, because even after this pandemic, resurgence and everything that is going to happen, we still will be having a lot of issues for this unorganized labor force, especially for migrant laborers who became reverse migrants, or migrant patriarchs who went back into their own hometowns now. Among them, you look at the kind of reports that are coming out. Without agriculture, without having proper water facilities, they can't do agriculture. And it is because of this reason they came into our cities to become migrant laborers. All right, but if we look into it, this is a greater problem that needs our focus, especially social workers' intervention in terms of unorganized labor force is something that we need to look at. 80 people died just walking from the state where they work into their parent states. These are all some of the news that we hear across, and it is an area where we need interventions to be provided. And also we look at the next kind of population, which is going to be children. 115 million children were malnourished during the pandemic. All right, this is one of the reports that is being spoken. Of course, I told you earlier itself, the Anganwadis were closed. Anganwadis, the ICDS program, is an integral component specifically for rural and tribal vicinities and to the poor income areas of the urban vicinities. Those children below the age of 4, below the age of 6, they all depend upon their nutrition supplements and the midday meals that were being provided in through the ICDS program. All right, completely locked. What happened to the nourishment part of these children? We were not able to cater. I wouldn't just blame the government alone. Of course, I would put a major say on the government here. As a social worker, I don't mind keeping my government as a villain because it is a democratic country and I have every right to question every system in the country. But partially, it is also with the communities that we need to look at. There were a lot of migrant communities who were not able to go back. They were staying. There were a lot of rural communities where, without such kind of supplements, there were issues that were happening around. How the communities were able to cater to social responsibility, it needed a lot of time to figure out. So in terms of nourishment part of it, the nutrition part of the children, it became a greater question. The other side of it, online educational modules. Right now, I'm not sure how many of you are listening to my lecture, because you see, psychologically spoken, they say 20 minutes is the attention span. They say, I think I've been speaking for about half an hour to 40 minutes at least. And in another 10 minutes more, I'm going to speak. All right, another 5 to 10 minutes more. I don't know how many of you were able to continuously listen to me. If such be the situation for an organized population like ours, think about those rural children, or think about those, young children who always need some kind of action-based learning, some kind of activity in their attention, and to make them learn a particular concept. Online education is coming up. You give a link to them, they click the link has an YouTube ad already. If it is a video that is coming through a YouTube link, the YouTube link has an ad already. It diverts them. Sometimes there are also harmful contents that are coming up. You should read about reports that have come out during the lockdown period. India has been facing increased access towards all pornographic sites. And for those of you who are thinking that pornography is going to do you good, I'm telling you, please no. Sex education, pornography doesn't give you proper sex education for that matter. In fact, it gives you the harmful way of learning about the good aspects of sex for that matter. Sex is something divine. Sex is something that is something very innate. Rather, pornography is actually bringing in different kinds of misconsumption, and I think the youth and the children are becoming vulnerable to this during the time of this pandemic. All right, and also we see mental health issues have all scaled up to a greater extent during the pandemic. All right, especially in Bangalore, NIMHANS had made a study, and it was reported. And after that only, we also had telecounseling services where my students are also involved as volunteers giving social work interventions during this crisis. We found out that see, a lot of people reported with anxiety. Even our own students who were in the final years, they have all reported with anxiety, sir. We don't know what, after 6 months, what is our future? We don't know. When this pandemic is ending, we don't even know if we are going to survive. Will we get jobs? Already the market is terribly hit, they are saying. If not social work, I think I'm going to end up in a BPO job. Please don't accuse me. Please don't make me a bad example to my juniors. This is what my students were reporting to me. All right. So the kind of anxiety that has increased during the pandemic again calls for crisis intervention from social workers during this particular time. So the last two slides here, with which I'm completing. I hope I'm not taking too much of time. Please give me another 5 minutes. I'll try to finish up. One aspect that we need to look at as social workers is that, you see, we have learned that, it is moving up. And now I think the entire country is in a phase where we are starting to accept this pandemic and we are trying to live with it, as how our honorable Prime Minister said some few months before very prophetically that, we need to accept this pandemic and we need to learn to live with it. Of course, yes, by the time I was more agitated why the Prime Minister is speaking in such a way, but now I think I can understand, and I'm also going on lines with what he's telling us. All right, we need to accept this pandemic. Yes, I agree to that in both ways, either sarcastically or positively as well. But you look at it, we accepting is one part of it, but rather it is also about continuing all the safety measures that we've been taking. The moment the lockdowns have been taken out, now I see that people are all moving very freely in the market areas, in all those grocery shops where we go for getting our essential supplements. I don't find the 6 feet distance that is being continuously being looked upon. All the state governments have opened up liquor shops. This morning, like after quite a few months, my family, we went to the church as a family together and we've come back. We were very happy. My mother just sarcastically made a comment and I'm still thinking about it. She said that the priest in the church said that no, only 100 people are allowed in the church. Please wear mask and come. And within the church also, if you're not able to give proper distance and sit, please, you can stand outside and you can listen to the mass, he said. So my mother got a bit annoyed with that. She's coming back and telling, yeah, these officials can come and check on the churches only how social distancing and all the other measures are being taken. What about all those taskmark shops that are open? I'm from Tamil Nadu, all right? And taskmarks are government-run shops for us. All right, so that is the truth, which is the reality as well. If you look into it, evening and morning, early in the morning, 7 o'clock, somebody goes to buy a bottle. They're saying, I've not seen it, but this is what I heard. But definitely in the evenings, I've seen a lot of men who come into our villages, they come drunk on the buses and all. There's no curfew, there is no restrictions, there is no kind of organizing is being done, there is no policing that is being done. But in such other areas, we find such kind of approaches that are coming. So which means that we as social workers, we need to emphasize in every place possible social distancing. We need to emphasize on wearing masks, using sanitizers, maintaining social distances, avoiding social visits and gatherings to the most. These are all some of the things that we still need to continue. On the other side of it, we need to work with the government in telling them to adapt bottom-up approach. Everywhere, wherever I go and I address social work population, I keep telling them, please always consider the grassroots population. If not for the grassroots, nothing exists in the country. There is no system without the base. The grassroots workers, the grassroots populations are the base of the country. So which means their opinions need to be considered, which means all these vulnerable groups that I spoke about earlier, their opinions about their development and their need has to be taken care by the government and other stakeholders as well. Gender specific interventions are needed where social workers can help in terms of mental health aid, mental health first aid at least, all right? Also helping in terms of crisis intervention with regard to gender specific interventions. We need to be on the forefront to work. Linkaging to government services is something that we need to work with, all right? Reverse migration has happened. All the migrant laborers who came from rural vicinities have now gone back to the rural areas. Now they don't know what to do with themselves. They don't know how to earn an income. All right. Skill development. We have the Government Skill Development Corporation. It is providing funds. Can we train rural youth, tribal youth through the Skill Development Corporation, provide them with skill-based opportunities so that they can equip themselves with the skills during this lockdown period or during this time of pandemic. And once everything becomes normal, they could use those skills to get a better job. This is one important place where social workers can really help out. I'm telling you, you and me as students and as faculties of different areas for that matter, we need to intervene in the field. That is where the point 3 very specifically I would like to say, and it is a humble request from my side to every academician who is into social work field, please don't restrict your students and say these are pandemic times, everything is online, so fieldwork becomes online. Please don't have this particular opinion. I'm very much against this opinion. Yes, there are risks involved. I think even the previous resource person, he focused about it, and he said that, all right. Yes, we need to take risk. Without risk, nothing comes. And this is where I quote about social work interventions during the World War I. I can also give you the references later. You can have a look at it, all right. How during the First World War and the Second World War, social work professionals were involved, especially medical social workers. These days, medical social workers are all becoming only those who work in the hospital settings alone. No, initially it was not meant for that. Already, if you look into the Lady Almonas, especially mother of medical social work who came inside, Mary Stewart for that matter, they were all people who worked in the field. They were all people who worked with people directly. These days, medical social workers to the most are rising up to work with patients or clients than to work with people or to work with human beings. There is a difference on that. So I would request every school of social work to send your students, if not organizing through your schools, ask the students to go and be involved in their own areas. If there is an Anganwadi in their area, can they go gather all those children with proper discipline? Can they make early childhood education for these children? Motor skill developments could be done by our own students for that matter. They could teach them basic alphabets. They could teach them vowels and other pronunciation. So many things we could achieve through this. So to all those people who are around, do not restrict yourself and say, yes, to keep ourselves inside is correct. But for social workers, I don't think that is how we need to be. We need to work in the field. We need to set ourselves in the field, and we need to do a lot of intervention. So this is one request that I would put forth through this webinar to all the social workers here. Never restrict yourself keeping the pandemic. If you're eating well, I'm telling you, you'll be able to endure this pandemic. Apart from all those people who are pre-morbid, the rest of you, I would recommend you people to go into the field, work for the vulnerable communities, become frontline workers, take the risk. I have an example of my own student. His name is Arun. He just finished his BSW. He was a volunteer among COVID areas. I myself, I was diagnosed with symptoms of COVID. I lost my sense of smell and I had severe cold. All right. What I did was I started taking kitchen remedies, and then he went and he's already a COVID worker, volunteer. So what he does, he works with the Bruhat Bengaluru Mahanagara Palike, which is the Bangalore Corporation. Went and got the medicines for me. 14 days, I quarantined myself. And like this fellow has been helping out so many people who have been in social isolation, who have been quarantining themselves. At last, this fellow contracted the virus. He was detected with COVID positive. He was hospitalized for a week, and then he came out successfully. He has taken the risk as a social worker, and I'm really proud to mention my student Arun over here, because you see, as teachers, we need to also acknowledge the kind of work our students do. He has been a frontline worker trying to work out his best in terms of volunteering, frontline volunteer, and then he has also accepted the risk and he has come out successfully. Now, because of his risk that he has taken, I am also able to understand the kind of health facilities that has gone inside through the government interventions as well. And we also need to promote sustainable agriculture, which is a very important area. All right. When the pandemic research, I remember one of the WhatsApp DPs that a colleague of ours was having. He said that when the lockdown was imposed, none of us ran behind gold and jewelries, or none of us went for buying real estate. Rather, we all ran to the grocery shops and to the vegetable market. This speaks of the importance of farmers. This was what is the message that I read on his DP. In fact, he kept it for about 3 to 4 months for this. So I am reiterating that again to us. Farmers, the rural population, the agrarian population, the indigenous population, these are the people who are making our life sustainable. So it is a social worker's responsibility to give them with sustainable development, to teach them with sustainable practices so that they can equip themselves better. Also, I'm telling you, English medicines were not that effective when compared to that of our Ayush, Department of Ayush, Ayurveda, Unani, Siddha, homeopathy for that matter. All right. These were the medicines that were more and more effective. For that matter, Tamil Nadu, I think, brought inside Kabasura Kudinir. I think now it is being distributed throughout South India at least. And I've seen that it has been very effective. The English medicine that we get are all just vitamin tablets and immunity tablets. Those, if you're taking proper fruits and vegetables, you have them all inside. In fact, half a lemon in the morning, half a lemon in the evening would give you the supplements of 2 tablets of vitamin C that you could have as part of the English medicine supplement that is being given during the pandemic for people contracting this virus. So we need to, especially medical social workers, community health workers, you can speak a lot about the Department of Ayush, which is a government department wing. We can also try to, promote tribal medicines. In a way, tribal communities also would get greatly benefited out of it. And speaking for the grassroots workers, ASHAs, accredited social health activists, almost 2,000 ASHAs have reported or registered a complaint with the primary healthcare center saying that no, we are being pushed. The doctors are not asked, the auxiliary nurse midwives are not asked. Myself and the Anganwadi workers, we are being pushed into the communities to intervene and find out COVID-related issues. This is the report that has come from Maharashtra. All right. Ashas are just honorary workers. Even their remunerations are not greatly paid for that matter, but they are the basic community health workers in the healthcare infrastructure of our country. The kind of support that we as social workers can provide for these grassroots workers is very much essential for us to look into. And even the simplest interventions can matter. Something that I take it as a learning also from the previous resource person who spoke is that, social workers, we needn't be smart always. We didn't need to do bigger things. I think somewhere he meant on these lines and he spoke. We don't have to do greater things. Rather, we can do even the simplest things. I think that is what you and me as social workers, we are demanded of. Don't look for greater plans. Rather, no, we just have to have a heart to help, and even the smallest help that we can give can be of a greater benefit to somebody out there in the field. This is my last slide, wherein I am also quoting the IFSW response towards social work, what we as professional social workers are supposed to do during the pandemic. Just these 4 points are there, that speaks about ensuring that the vulnerable people are included in the planning part of it. Bottom-up approach I spoke about, this is what they have told. Organizing communities to ensure that essentials such as food and clean water are available. Potable drinking water in the country is still a question mark. 65% of the rural vicinities do not have safe drinking water. This is what is the government's report says. The government of India reports this. All right. To such kind of communities, we need to ensure safe drinking water facilities, advocating within social environments that services adapt, remain open, and proactive in supporting communities and vulnerable populations. All right, and facilitating this physical distancing and social solidarity. This is very important to be followed. I think in many parts of our country, it is not being stressed upon, where we need to take it to the next levels of promoting it. All right, and we need to promote by advocating for the advancements and strengthening of health and social services as an essential protection. This is again an important part what the IFSW is telling us, a response that we as social workers can provide. So ultimately, if you look at it, we have been helping out in terms of being advocates or helping out in terms of policy making, but we need to make them more concretized, because all the vulnerabilities that I'm speaking about in terms of these communities have been existing even before. But the pandemic has brought them more into the limelight, and the pandemic says that social workers' interventions are very greatly needed. Lastly, I would like to conclude with the pledge that I read about from the National Association of Professional Social Workers in India. The pledge says that, walk with the marginalized and engage people and structures to address life challenges and enhance well-being. This is the crux on which we will have to work during the pandemic and post-pandemic as well. It is the marginalized communities that needs our interventions the most. And we need to engage with people. We need to address life challenges to various government structures and other stakeholders, such that the vulnerable communities are ensured of a better well-being. With this, I conclude. Thank you for the opportunity provided to me.
Thank you, sir. It was indeed a wonderful session, and it is remarkable that you have covered almost all the issues faced by the vulnerable groups, both commonly and also in the context of COVID-19. And in this short period of time, we are open to the discussion. Audience, please make use of the comment box to address your queries. Sir, can we go on with the questions?
Yes.
We have a question from Sajish. Can you suggest any link or magazine which mentions the problems faced by the tribes in Kerala?
All right. I think I may have few references. What I can do is that to the organizers, I would be emailing it to them. Maybe you can contact the organizers and you can get it. Or you can also email me, Insta to me or Facebook, wherever you could find me. You can also ask me. I will try to send you the references of whichever I have read from and I've taken the information. I can take that and I can send it to you.
And
Okay,
to
sir.
this question, in our participants, we have Father Lenin. He's also well-known activist for tribal. So, Father Lenin, can you answer this question? Is there any magazines, especially for tribals in Kerala, focusing on tribals in Kerala? Father Lenin?
About every minute data.
Sir, your voice is
Tribal
not audible.
Once more, sir, can you ask me? What is the question?
Your voice is breaking, sir. Can you talk again? The first.
Okay. Could I ask the question once again?
Huda, please. Huda?
Yes, sir. Can you suggest any link or magazine which mentions the problems faced by the tribes in Kerala?
Oh, that you just in that if you go, plenty of material will get about problem, or you can put me also about Attapadi. I can give you basic details about issues. Whereas about Wayanad, I can give refer an NGO called Tudi. If it is in Idiki or other places, we have persons who are working with Adivasis. They can give details.
And adding to that, we have also organization working for tribal development like Kitats and all. So if you visit their institutions, you will get a number of magazines and articles. And also you can refer to the journals, especially for tribal development, you can refer journals. So like that, you will get idea about the tribals in Kerala, especially in tribal in Kerala. Thank you.
I think apart from that, also, I think the government of Kerala has a particular website where it is updating. The Ministry of Tribal, the central government's Ministry of Tribal Affairs also has country-specific, state-specific programs that are running, and they speak about them on the website as well. So maybe the official website also might give you certain links. Apart from that, whatever I have access, I can send you the links of those, the references of those. Yes, also, you can have a look at it.
Yes, sir. Sir, also ITDP, Integral Tribal Development Program, also will give details. ITDP. Yeah. Thank you.
Thank you, Father Lenin. Thank you, Alan. Next question, Huda.
Yes, sir. We have another question from Raj Ratan. There are also so many positive things about tribals that they are independent and not dependent on anyone for food, grains, etc. That leads to less chances of being affected from COVID-19. What do you think?
As I said earlier, see, I am also like Father Lenin or others who might be asking this question. I'm also a person who works with tribal development. If you look at it, we cannot generalize it completely though, because as I said earlier, in areas where there is proper irrigation facilities available, where there are natural resources available in plenty, tribes are flourishing, specifically hill tribes for that matter, because the moment we speak of tribes, most of them can only think of hill tribes. All right, but apart from that, we also have denotified tribal communities. We also have tribes who live on the plains. There are very rare specific tribal communities, very small hamlets of 30 households or 40 households who live even on the coastal areas as well. Such kind of populations have been greatly affected by it because they have been depending upon the public distribution system. I think on the slides I had one example, but I didn't speak about it, is that about 40 households who were belonging to a denotified tribal community in New Delhi, they were asked to move during the pandemic. That was lockdown 1. They didn't know where exactly to move, because of which what they did was, they for a temporary time, they made a makeshift house beneath a bridge. All right. The picture also, I still remember looking at it in the newspaper. 40 households, they moved nearby to a great sewage water plant below the bridge. They were hiding over there. They were not staying there. They were hiding over there because if they are being seen outside, the police will come and arrest them, or the police are forcing them to go back again to their hometowns. because of which they were hiding there for some point of time. Later, organizations went and helped them out with the groceries needed, the rations needed for them to supply. So these are vulnerable communities still. They are tribes as well. But if you look at them, they don't get natural resources available for them. So they purely depend on the PDS system of the government.
May I comment something about this issue? I am Rajat Kumar. May I comment on this issue?
Yes, sir.
Yes, sir. Yes, sir. Please,
Okay.
sir.
Okay. See, we did some research about the tribal community malnutrition and psychological development of children. And the finding was very disappointing in the sense that the children are a higher rate of malnutrition is prevailing among this community. Children malnutrition
Okay, some technical issues. We'll move to the other question. There is one question from Cletus Susate. As an institution, social work colleges are responsible to the parents of the students. Hence, one can't force students to get involved in the field work. Can you comment on this, sir?
Yes, I think because I'm being invited as a guest person, I think I don't want to make this question as a debate. But I think, honestly to speak, if such is the attitude of social workers, then it is up to them to look at it. All right, because I feel social workers are here to work for the grassroots, and in times of pandemic where the issues that are running across us, if you're not able to intervene, keeping our lives first at stake, then I'm not sure. Maybe the common answer that somebody can give me is that, no, okay, these are unmarried. What do they know about families? Or they don't have children. They cannot take risks. These are some of the common answers that we might receive. But I'm telling, social workers are meant for the field. Social workers are meant to work for the communities. If we are not able to work for it, then I'm not sure what could be done. Such kind of population should go for elite kind of social work practices that are available in other countries. I think they would greatly benefit, but not in India.
The next question.
Okay, sir. Thank you. We have a question from Sim Vennen. How do you think about the role of civil society during this pandemic? Is it watchdog role or a frontline worker?
I think this again has been region specific, but I would say that a lot of people have volunteered. A lot of, at least the initial phases, we were all, trying to understand, even social workers, we were trying to understand what was happening around. When the lockdown was imposed, we were not able to understand what exactly was happening. And people were all panicking because this 21-day lockdown that was implemented the first time, we didn't know what would be open, what will not be open. So those whoever had, we were all running. But later, I think, as we started settling down and understanding whatever has been given, whatever was the facilities provided and the timing framework, when to go for essential services and stuff like that, then I think a lot of communities came inside and they have volunteered. We had different organizations that have worked, and communities, even the local communities, they have come up together. Kudumbashree, for that example, is a good community initiative that I can quote. 40 lakh women involved in this particular project as beneficiaries as well as benefactors in creating community kitchens where people food security, wherever there is food security, they have tried to help them out. So in a way, community has also been frontline volunteers, I personally feel.
Okay, there is one question from the YouTube live. Am I audible, Alan?
Yes, sir. Yes, sir. Yes, sir. Yeah.
Yes. That question is by Nivedita. Any social work method you suggest for dealing with the problems of COVID-19?
I think all the methods are deployable if you look at it. Basically, in areas, if I have to give you one example, let's assume that there is a migrant community who's staying beside your community. They have lost their job. They're not able to go back to their hometown. They're waiting for all those areas to become normal so that they can get back to work again and start functioning. Now, you as a social worker, first time, if you're going inside, you're conducting a research. All right, survey is part of research. Based on the research, you found out what are the needs that are there. Now, with that, you're trying to work with the different stakeholders first possibly with the government, that is maybe with the local ward councillors. You're trying to say that these are migrant workers who are staying with us. What can we provide for them? What are the opportunities and stuffs like that? I think at this level, from research, you moved on into community organization. All right, you will be looking into social planning model of community organization, because based on a research, you're trying to plan something out for the community, and with the interaction with the community. So this moves on to community organization, and you are also finding out skills based the community skills, which person is skilled in what. You're trying to make an assessment of that. Based on the skills, you're trying to refer them to different organizations, and if you're trying to get them a better employment opportunity, then for sure you're doing casework, because it is an individual intervention based on their skill set. You're trying to provide them with an opportunity. It can for sure be called as a casework as well, because casework not only deals with counseling. Counseling is just one technique in casework, but there are other essential services also that we can provide. Any individual human need that you provide can be a casework intervention as well. Apart from that, if you're going to refer them to a particular organization or to the skill development corporation and enhance their skills, enhance the well-being, maybe you're trying to help them over to the group therapy or stuff like that, then I think you're using group work. So in a way spoken, I am sure that all the methods are equally applicable during this particular intervention time. I don't think any specific individual methods need to be focused. All the methods can be practiced is what I feel.
Thank you, sir. Huda, is there any other questions?
Sir. Yes, sir, we have questions. Charanbag is asking about the medical social worker in the community medical department in this pandemic situation.
What are the role of medical social workers in community?
I think I think medical social workers during this time have really worked very well. All right, specifically, I can give you examples of our own department alumni who have all been cloistered within the hospital settings. Now they have all moved into the communities. I think medical social workers have moved in. They have taken the roles as educators, creating awareness in every place possible. They have, I think, very specifically from the Northeast, all right? This particular medical social worker, he has got in touch with a university there, with the chemistry department of that university. They made hand sanitizers with alcohol, a localized version of hand sanitizers. And then he has taken them all into the community, and they have distributed free hand sanitizers. All right. I think by February, March and all was the time where we also saw a lot of do-it-yourself hand sanitizers that you can make at home with alcohol. One of the interventions was like that by a medical social worker, and also they went into looking at other aspects of it. NIMHANS was effectively involved with community mental health as well. They already have a unit for community mental health, and I think during the pandemic they made use of it not only just to cater to mental health, but also into other community services and public utilities. So like this, there have been medical social workers who've been doing a better job in the field.
So we have another question.
Now time 1:15. I think you could give
Yes, sir.
the link.
Last one question, sir. Then
link.
we'll. Yes, sir. Last one question from any participants, especially from students, because in our participants we have lots of students. We have any questions?
Sir, can I go with a different question which is already asked?
Yeah, please.
Last question. What does it mean to be vulnerable in the era of COVID-19? The question is from Manju Rostom.
What does it
mean to be made vulnerable in the era of COVID-19?
What? No, maybe can you rephrase the statement?
We want to reframe that. Actually, that question may be asking like why that vulnerable and COVID-19, especially our theme, vulnerable and COVID-19. Why we are stating the word vulnerable and COVID-19? Maybe she may ask in that way. Am I right? The participant can unmute and you can ask. The participant can, if the participant is here, you can unmute and please ask the question.
Sir?
Yeah, please, sir.
Hello?
Your voice is breaking, sir. Yeah, please, sir.
Sir. Sir.
Yes, sir. Please.
Yes, we could
Yes,
hear
sir, you
you.
can talk. Yeah, please talk.
Sir, sure, sir.
Voice is breaking.
Reopen of.
Sorry, sir, your voice is breaking. Yeah, your voice is breaking, sir. Sorry, sir.
Hello.
Yes, sir.
This is Hussain from Andhra, sir.
Yes, sir. Tell me, sir.
Hello.
Yes, sir.
Hello. Sir. Hello.
So you,
Sorry, sir, we couldn't hear
Hey,
you, sir.
audible?
Your voice is breaking. We couldn't hear you. No, sir.
Thank you.
Sir, please type in the chat box, sir. Whatever question, please type in the chat box.
Okay.
Over to Huda. Huda, please, we can wind up.
yes, sir. Can we move on, or should we wait for him to ask?
No, I think it will be better if you could move on, because I think I could say a
Yeah,
lot of
yeah.
comments about feedback link.
Yeah.
Okay, sir, and we are also
You
running
can
out of
put
time.
Okay. Moving to the next section, I would like to welcome our first person of today, Dr. Alan Godfrey, say some feedback about today's section.
I think I joined by 10:30, so I was not for the initial part of it. I think I was there when the Vice Chancellor spoke. I was there by then, and then I was also listening to our previous resource person as well. It was interesting for me as well, because you see, I'm also one social worker who went back to when I because I felt overworked. The work burden was a bit extra, that I thought I need to spend some time home so that I can relax. So I came back. So for me, I found it more relevant in understanding the context. I was able to understand more in the
Sir.
session about. Hello.
Well,
Azim, please mute Hussain, sir. Please mute Hussain, sir. Sir, your voice is breaking, sir. It is disturbing for us. Please mute yourself. Sir, your voice is breaking. It is disturbing for us. Can you mute yourself, sir? We have seen your question. That is role of social work after unlock. We will address it, sir. Azim, please mute.
I think,
Alan, sir, you can continue.
yeah. As I said, Dr. Mirshad, I think it makes a lot of sense for us, specifically during this pandemic, to speak about social workers. And I think the first resource person also, when he stressed about that, I really like the part where he said that, no, we are educated in a way where, social workers are the best, and we keep portraying we are the best. And of course, yes, we could be the best, but we also need to understand that we as human beings, we need to function in an efficient way where we balance ourselves better. So I think it makes a lot of relevance. And on the other side of it, this pandemic is ongoing. On the context of this ongoing pandemic, speaking about the vulnerability aspect of it and the role of a social worker, it is very much essential. So in that way spoken, I think this webinar serves justice to what it has been convened for. Thank you for the opportunity again.
Thank you, sir. Thank you for your valuable time. It was indeed a very good presentation, and we are very fortunate and happy to see you here. And Dr. Alan Godfrey is one of my friends too. We have worked together for long years also. It's very nice to see you in this platform also. So I like to thank on behalf of the department as well as from all the organizers, the MG University as well as other colleges. So here we can have some feedback from the participants about today's section. First, we'll go to our academic director and academic director BG Unisa for a short feedback. Then we'll move to two feedbacks from the participants. Then we'll go to the concluding remarks. Thank you, one and all.
Thank you, Mishat. In fact, I listened, though I was there in behind the curtain, listening both Alan and as well as Moothedan, Joseph, Francis Moothedan. What I analyzed, Francis Moothedan, he talked more on the field level, the problems they're facing it and how they are working on it and what are the social problems they are undertaking it, many aspects. But Alan Godfrey is found to be a more research type, something to be very interesting. And, to have a speaker, resource person touching on both aspects, social and I call them as a researcher, basic and applied. It was very informative. In fact, for the students and as well as the faculties, or the social worker in general, associated and working very deeply in the social aspects as on today, both the talks were very interesting and very useful and very much applicable. A lot of things they learned and they can learn from there, and the interaction was also very good. I always use the word what Moothedan said, it's a very divine job, and the society is always recognized. And as on today in the pandemic COVID, the role involved, whether it's a medical sociology, because what Alan Godfrey said about the Northeast, since I worked in the Northeast for about 40 years, more than that, I was associated in really with the research. I know the problems, what they are facing it, but as far as the tribal community, whether it's in the coastal area or in the hill area, whatever it may be, the role of the social worker is highly, we have to appreciate them, and still they are working on it. So I on behalf, in fact, happily and very nicely, very, made it more knowledgeable, and the same like the students and faculties enriched with both their talks. It was a very excellent arrangement, and I'm really thanks to the MG University and as well as the James College for making such webinar most beautiful, most informative for the students and the teaching faculties in the social sciences. Once more, thank you very much, and also appreciate and thanks to both the speakers, resource person, for participating and spending their time in a very, valuable way. The talks were very knowledgeable. I really enjoyed and appreciate them. Thank you very much.
Thank you, sir. Thank you, sir, for your valuable feedback. I know you are very busy because tomorrow onwards you are going to organize 10 days conference, national conference in a department. So with all your support, and we are expecting all your support and guidance in our future programs also, sir. We are very blessed that we are working under your guidance. So happy for you, sir. So again, like another feedback, we have Raju sir from MG University. Sir, can you say some feedback about today's section? Raju sir? Raju sir is here. I think Raju sir is not here. Yes, sir. Yes, sir. Please, sir.
Sir, he's not here.
Yes, Raju sir, he's here.
Sir.
Yes. Sir?
Sir, I think he's not.
Oh, sir, he's here. He's here. I can see him. Raju sir? No. Okay. Let me invite the director of Adi Atapadi, like Father Lenin, to say some feedback about our section. Lenin sir? Father Lenin?
Yes, sir, I can hear you.
Yes, sir.
My sincere appreciation goes to, of course, the School of Behavioural Science, MG University, Kerala, and of course, GEMS, BBM, AWH, the organizers. Of course, both speakers, our Francis Moothedan as well as Dr. Alan Godfrey, both did very well. And but of course, the way they were performing was different. Second one was, of course, very professional and scholarly. Of course, he's my friend and he's teaching in St. Joseph College, Bangalore, Dr. Alan. And I feel very proud and very meaningful, very useful sessions. I found it very informative, very interesting, very useful. Only in the beginning we had some confusions and so on. That is a problem. Otherwise, timing also we should make sure, suppose we should announce like till 1 o'clock. Then we should stop. So many were like outside, many were participating. They were 1 hour before they started. I was asking about link. Otherwise, the sessions were very useful, very meaningful. I appreciate once again our, of course, Mirshad Rahman and our one that moderator Huda Ali, Anjali, and of course all present, and of course the VIPs like VC or Manjalanguleri, MLA sir, Raji sir. I feel it was very professional. Well done. Congrats one and all, and thank you all the presenters, especially the resource persons. Thank you, sir.
Thank you, sir. Thank you very much, sir. Any one or two feedback from the participants? Because sorry, I don't know like much of you. Can you please unmute yourself and please tell your valuable comments? If it is bad or good, we need feedback. Please come with your feedback. Thank you. Any feedback from the participants, please? Any from students? We have participants from all over India. Anyone? Okay, Huda, there is no feedback, I guess. We'll move to the next proceedings. Over to you.
Okay, sir. As we have completed both of the sessions of our webinar, I would like to invite Mr. Sujish K, Vice Chairman, NSWPC 2020 and Head of the Department of Social Work from AWH College, Calicut, Kerala, to deliver the concluding remarks.
Thank you, Huda. Good afternoon, Honorable MLA, respected Vice Chancellor and University, Honorable dignitaries, and dear participants. We have reached the end of the webinar, and it is my task to provide some concluding remarks. It is also a privilege and honor to me entrusted with such an undertaking at a gathering of such eminent people from different parts of our country. Main theme of our webinar was social work, prevention, and COVID-19 pandemic. Social workers are supporting communities that are affected or fearful of the COVID-19 virus. Social workers has an essential frontline role in the fight against the spread to support communities and others. COVID-19 pandemic affects all parts of our life into an infectious disease.
Okay, sir, excuse me, sir. Sir, your voice is breaking.
Sir? Okay, sir. Am I audible? Hello? Sir, may I
Yes,
audible?
sir. Yes, sir, you are audible.
Okay. Along with overwhelming uncertainty and new behavior norms like mask wearing, physical distance, and COVID-19 has changed how we meet our daily needs, how we socially interact, and whether how and where we work. Millions of job workers have continued to visit the workplace, while others have transitioned to full-time telework, and for many the demands are changed or intensified. The nature of each situation is unique, but undoubtedly some of these changes are contributing to increasing levels of economic insecurity and occupational stress. However, we expect we can survive the COVID-19 pandemic. I think all the participants are very actually involved in the webinar. I would like to express my appreciation to all the participants for taking time out of your busy duties to attend the webinar. Thank you all. Thank you very much.
Thank you, sir. I request all the participants to turn on your camera so that we can have a photograph together of the participants. All the participants, please turn on your cameras. Can someone from the technical team inform if it is done? I think we can move on to the next part. Thank you all for your cooperation and informative session with us. And please accept our heartily apologies for the delays occurred and other inconveniences and technical issues in the live streaming. The feedback link is provided in the comment box. Please note to fill through the form, as certificates shall be provided based on the details provided in the feedback forms. Last but not the least, I would like to invite Mr. Sajo Joy, Vice Chairman, NSWPC 2020 and faculty from Department of Social Work, BVM Holy Cross College, Kerala, for delivering the vote of thanks.
Okay, thank you, Huda. Respected President of this webinar, Dr. Rajiv Kumar, Honorable MLA Sri Manjananguri Ali, Honorable Vice Chancellor Professor Dr. Sabu Thomas. I am not taking many time for my introduction. I am directly come to my role. First of all, I would like to thank Dr. Rajiv Kumar N, Professor and Director, School of Behavioural Science, Mahatma Gandhi University. I convey my sincere gratitude to the Dr. Rajiv Kumar. Thank you, sir.